We worked in a district where there was a population of 600,000, and they considered themselves lucky that they had 5 physicians.
There are just piles of patients lined up at the outpatient clinic waiting to be seen.
The families milling about, mothers with a child on her back. You would see one bed next to another bed, next to another bed, sometimes 2 patients to a bed.
You're looking at maybe some of the sickest people you've ever seen, and you lean over and you say to this old patient, habari, which means how are you? He always says mzuri, which means I'm fine. Even at the most terminal stage of disease, if they can find breath at all, they'll say mzuri.
I've been very happy with what's happened over the last 10 years, as over 200 or so individuals in one way or another connected with the program have participated in Kenya, and likewise a number of Kenyans have come here.
We wanted a setting that really wasn't looking for high-tech, expensive Western medicine, but was basically trying to develop a collaboration around primary care, hands-on type of experience.
I think one needs to have been there 10 years ago to see what was there and what is there now. There was absolutely nothing 10 years ago.
This is really a university-to-university exchange.
I think both of us benefit from the collaboration.
And it's a two-way street that works, I think, in very much the same way to promote better health, better leaders, better students on both sides of the ocean.
IU students in this partnership, they get to come to Kenya.
I go to Kenya and I learn about the humanity of medicine. I learn about the dignity of medicine, the true meaning of where medicine was founded. And now they come back and they come with us and we teach them the technology, the advancement of medicine, the cutting edge of medicine. So it's a really neat exchange.
There are just things that are so important to understand about the world by experiencing it kind of in the raw. And Kenya gives you that experience.
Our own students and our own doctors need to be exposed to problems that are outside our borders.
Interesting patient for you to see.
So you could see the crystals?
Yes, on the slide.
Okay.
On the slide, you should be able to see the crystals.
I think once touched by the Kenyan experience, we all of a sudden become citizens of a very small world.
That's what last week she participated. But it's much more.
We all have the same goal as being doctors, and that's to help other people and to make them feel better. And that's an international, universal kind of thing for doctors. So with that, we were able to work very well together with the same goal of taking care of patients.
In Kenya, what we have to work with primarily are our hands and our eyes and our ears and our noses.
You need to talk to people, you need to touch them, you need to interact with them.
I watched them in their interaction with the patients, and it wasn't just a physical healing that they were providing, but it was also being a friend and being someone who cared about the condition of their patients.
I think the common bond which exists between the students here and we from Kenya is the fact that we have respect for the human life. The only complaint she has today is she's complaining of abdominal pain.
Students and residents over there see a number of things that they rarely, if ever, see here in this country.
Tropical infectious diseases are a much larger issue there.
I saw exams that I've never seen performed before. I've seen diseases that I'll never see because we just don't have them here. I saw a baby die. Probably one of the saddest experiences I've ever had.
It's hard enough in our own culture for a physician to confront death, much less to move to another culture and to confront it for the first time in one of her patients.
This child in Kenya would have a 0 chance of survival. Most of the preterm babies in Kenya do die, and they die from lack of very basic nutrition and sometimes just oxygen they would need for a few days, but it's not available.
Being in Kenya totally changed my outlook on what I thought being a doctor was.
So although it's done in a third world country, 12,000 miles away, the impact is here.
One of the things I took home from being in Kenya is that the doctor-patient interaction is still the central issue.
Thanks, Mr. Du Bois. Bye, sweetie.
Okay. A patient walking in now to Dr. Oates in Indiana benefits just from that I have a deeper and broader perspective.
What usually happens is you have lots of great blood sugars and the occasional crazy 240s.
And I really do feel that I'm a better person for having gone, and it wasn't anything that I did for anyone, but it was what the Kenyan people taught me and did for me.
I've been to the emergency room in this hospital, and I've been so impressed by what I've seen. I think I would like that for my country, to be able to help people at that critical time when they need that help. Yeah.
I know that they're facing incredible odds, insurmountable by my standards, but somehow they're going to go back, and hopefully we can help them here to surpass that and reach their goals and even go farther.
An example is they have an ultrasound machine over there, but no, very few are trained to use it. And so maybe if they come over here and learn about how to use the ultrasound machine, they can use the technology that they have there and make the most of it.
The redness has gone away here that was here yesterday. And let me see the other side of the dorsum of the foot.
10 years from now, I can say the impact will still be there.
And when a country decides to send its best and brightest to medical school, if you want to get to between the ears and affect the attitudes and the hopes and even the vision of the future leadership of Kenya, you better be in medical education.
A day doesn't go by that I don't think of my experience back in Kenya. And actually I talk a lot about that in rounds with students and with nurses and with my colleagues.
Although my experiences aren't tangible and something that someone can touch and maybe say, well, you know, I know that she learned this and this and this. It's just things that, you know, I'll carry with me as I'm a physician 50 years from now.
It's definitely the most influential 2 months of my career.
It not only opens your eyes medically to the world around you, but it just opens your eyes.
I think, to me, being a doctor is a little bit of a sacred trust.
It means commitment.
The kind of a doctor I hope to be in the future is a doctor whereby I put first the needs of my patient first.
I can't give enough praise to this program for what it's done for me.
The program is about promoting the human spirit and fostering that which we think is best in the human spirit.
It's a program that's done for the right reason, by the right people, with the right values.
It reminds one what medicine is at its best, and it's a wonderful thing to keep in mind as you teach young physicians.
You make a student grow, and you create a doctor that people love to visit, that people would want to know.